Thank you, President Judy. Good morning. We are still seeing a relatively small number of cases of COVID-19 in our schools. The health department has been very responsive to the needs of districts, and that partnership from both a health and communications perspective is working quite well. I'll begin my update by pleased these waivers have been extended through the rest of the school year. We are now in the process of working with our local school nutrition staff to support them in implementing these waivers. In addition, last week we closed our first administration of a monthly data collection designed to monitor trends in student instruction modalities, such as in-person and remote. We will collect these data on a monthly basis at the end of the month. Nearly all districts, over 90%, responded to this data collection. We still have some data to clean up from independent schools, but these charts on the screen provide a good summary of the general trends across the state as of the end of September. So overall, as you can see, about 62% of our schools are in a hybrid mode. I would collapse the fully remote and the hybrid into some kind of hybrid mode, and that would be closer to 70 to 80%. Again, these are data from the end of September when we first announced the shift to step 3. So we do anticipate a shift to more in-person instruction the next time we do this collection at the end of October, so later this month. And if we can go to the next slide. So as expected, as you can see here, more elementary schools are utilizing in-person instruction than our middle school and high schools. This conforms with our policy emphasis on prioritizing in-person school experiences for elementary students and the fact that remote learning tends to be more viable for older students. We will report these data on the Agency of Education website going forward and use the data to consider additional guidance for school districts. We will also be updating the map that we developed with the Department of Financial Regulation to show patterns from the initial school district reopening plans. Finally, one issue that has emerged as a concern from districts in the last week or so is holiday travel. Governor Scott noted this as well in his remarks. We're hearing that schools are concerned about the implications of holiday travel on their ability to offer in-person instruction. In an interview this week, Dr. Fauci stated we should not expect Thanksgiving to be a typical holiday this year. He encouraged us to be very careful and prudent about social gatherings, particularly when members of the family might be at risk because of their age or their underlying health conditions. So it's probably important for all of us to carefully review our holiday travel plans in the coming months. To be sure, celebrating holidays are important for our mental and emotional well-being, but it's probably important that we also acknowledge the public health implications and factor those into our decision-making this year when we can. That concludes my update. I will now turn it over to Dr. Kelso.
Thank you. Good morning. As you heard, Dr. Levine is taking a few well-deserved days off, his first, I think, since February. If you've been following our data, you know that we are up to 1,915 total cases in Vermont during this pandemic. And many of you will have noticed that we went from several days of just a few cases, new cases each day, to 10 or more cases each day in more recent days. It's a bit concerning, but it's not at all different than what we've been forecasting and talking about. We anticipate that as the weather gets colder, as we get into the fall, as schools are open and other things are opening up a bit more, we do expect to see more cases. As you can see on the slide, I'm going to talk about an outbreak that we've been investigating this week, an outbreak of COVID-19 cases among members of a youth and adult recreational hockey and broomball teams in central Vermont. And the link among the cases came to our attention last week thanks to our contact tracing efforts. The outbreak is associated with people who practiced or played at the Central Vermont Memorial Civic Center in Montpelier earlier this month, and it appears that cases are limited to players and their close contacts. So far, there's no indication of community spread of the virus. As As of this morning, we've identified 18 confirmed cases among players and their close contacts. Most of the cases so far have been identified among adults, and the health department has informed schools if any of the youth were in attendance at school while they were infectious. The contact tracing team is continuing their work to identify and reach out to people who may be affected. So please, it's important that you answer the phone if you get a call from the health department. This is how we give you and your family the information you need to know if you're at risk, and it's key to our ability to contain outbreaks and spread in the community. Tomorrow, Saturday, there will be a pop-up test clinic at the Barry Auditorium from 9 a.m. to 3 p.m. And we're recommending that anyone with direct links to the teams, their close contacts, and people associated with the Civic Center be tested. Testing is not recommended for the broader Montpelier community in response to this situation, but the clinic is open to the public. To make an appointment to be tested, go to healthvermont.gov/COVID-19-testing. And these two slides, if we could go back to the previous one, please, thank you, indicates the dates of onset of each of the cases associated with this outbreak. And we've identified through contact tracing efforts that there were multiple opportunities for potential transmission between the end of September and the very early days of October, resulting in subsequently identifying these cases with some limited transmission to close contacts. But again, no community spread has been identified at this point. In addition to the other cases reported this week, 2 cases are associated with Union Elementary School in Montpelier. These cases are the first instance in Vermont of transmission within a school. As with all cases, we're working to identify close contacts and have been working closely with the school and district officials to investigate and in their efforts to keep their students, teachers, staff, and the community informed. These cases are not associated with the hockey-related outbreak. The fact that this is the state's first in-school transmission doesn't mean an escalation of the virus. It means that someone who is infectious transmitted it to someone, just this time inside a school rather than a workplace or a long-term care facility or other setting. It does mean that despite our low rate of COVID-19 in Vermont, this highly infectious virus is still at a risk to Vermonters. And we have to keep up our own personal and institutional efforts to prevent its spread in every way that we can. I want to share our concerns about travel as well, especially with the fall and winter holiday season coming. Unfortunately, the latest travel map from Commissioner Pichek isn't showing many green counties in areas beyond our borders. So this means that if you do decide to leave Vermont, you likely will need to quarantine when you come back. And if you have visitors from out of state, they will need to follow our Vermont quarantine rules while they're here. We all want to see our friends and family who live farther away, and because these are people we trust, we may let our guard down more than we usually do, to not worry too much about their county and whether it's green. We might sit closer to them, spend more time together, or take our masks off. But the fact is, we don't know, and they may not know, if they've been exposed to the virus, especially if they live in an area virtually anywhere outside Vermont with a higher prevalence of COVID-19. Tests before they arrive or at the time that they arrive reflect just one moment in time, and it still may take several days from the time that they were last exposed for the virus to replicate in their system to the point where a test can detect it. This is why following our prevention guidance and quarantine rules is so important. As we move indoors and as schools are open, we need to make sure we're keeping these social and holiday visits as safe as we can. We're all chafing at the bit. Keeping our guard up for months and months has been hard. But the virus doesn't watch the calendar, and we need to continue to take these precautions and work them into our daily lives. I also want to mention the role of testing when it comes to travel. Starting this week, you may have seen that rapid antigen testing is available at the Burlington Airport. And we appreciate both the City of Burlington and airport officials being partners in educating travelers and visitors about preventing spread of COVID-19. As we've said, testing is one critical tool to find the virus and prevent its spread. And there are several types of tests, each with its own best use. And as Dr. Levine has discussed, antigen testing is different than PCR, which is the gold standard, but antigen testing does have a role and can be useful. In general, we've said antigen tests should not be used to diagnose asymptomatic people, but they can be informative for people who have a known exposure to a confirmed case of COVID-19. If you do travel to Vermont by plane, you still need to quarantine for 14 days. You also have the option to be tested on day 7 or later to shorten your quarantine, but it needs to be a negative PCR test. And remember, testing is not prevention. Test results give you a snapshot in time of whether you have the virus. Following state guidance and rules will help keep the virus from spreading. And finally, on a lighter note, Halloween. It's getting closer, so I wanted to remind people of what Dr. Levine has said here before. You can still celebrate Halloween safely. Like other places we go these days, we just need to keep 3 things in mind. First, can you keep a 6-foot distance from people who aren't in your household? Walking around a neighborhood outside is a good example of that. If you're giving out candy, think of creative ways to keep that safe distance, like having bags of candy ready to grab or set up a candy slide. There are lots of good and sometimes extravagant ideas on the internet. The second, are you and others around you wearing masks? We're all used to getting to wearing them by now, but it's a great time over Halloween to incorporate them into our costumes. And finally, number 3, how crowded is the place you're going? Keep your group small and remember that outside is always safer than inside. If you're trick-or-treating and one neighborhood seems too busy, skip it and move on to the next one. And as always, if you're sick, please stay home. You can eat the candy you bought, just don't tell our nutrition staff. We all need to find ways to balance the seriousness of the pandemic with some fun. And if Halloween is your kind of fun, you can find safe ways to celebrate. And now I'll turn it back to the governor.
Thank you, Dr. Kelso, and then we'll now open it up to questions.